If there is one quiet problem that is secretly keeping many American men up at night, it is that moment when their body seems to betray them exactly when they need it most, and they feel too ashamed to say a word to anyone. You may never talk about it, but I understand that feeling very clearly. There are those times when you are being intimate, and your erection suddenly fades the moment your mind starts drifting into anxious thoughts. There are those mornings when you walk into the bathroom, start to urinate, and the stream suddenly splits in two, spraying everywhere so that you feel both embarrassed and worried. There are those evenings when you watch a few adult clips, compare yourself with the actors on the screen, and quietly ask, why do they look so big, while I seem completely average? Those questions are not yours alone. They are the private concerns of many men out there. Most of them choose to stay silent, pretend nothing is wrong, while inside there is a constant storm of worry, shame, and self-doubt. Today we are not going to dance around this anymore. I am urologist Dr. Laura Bennett. I have spent many years working with men of all ages, from men in their 20s and 30s to men in their 60s and beyond. Every single day, I hear stories that are surprisingly similar. Doctor, every time I start thinking, what if I lose it, I end up losing it. Sometimes my urine stream splits, feels weak, or I have to get up many times at night to go to the bathroom. But I tell myself it is just aging, and I try to live with it. After watching adult films, I only feel insecure, because I always believe I am too small compared to them. Inside my clinic, I see these issues as medical puzzles with clear solutions. Out in everyday life, men treat them like harsh verdicts that say, I am no longer a real man. The goal of this video is very simple. I want to remove that layer of shame, call each problem by its real name, explain it clearly, and give you a specific action plan that is scientific but easy to understand, so that you can feel calm, in control, and confident again. First, we need to talk about the silent enemy behind many of these so-called failures in the bedroom, which is anxiety and overthinking. Many men believe that whenever they lose an erection, it must mean that their body is broken, their testosterone is low, or that they have become weak. In many cases, especially in men who are still relatively young or whose overall health is generally good, the real issue lies in the nervous system and in the way the brain handles the situation. This is what doctors call erection problems that are driven mainly by psychology. It often begins in a very simple way. The first time, everything seems normal, and then suddenly the erection is weaker than usual or disappears earlier than you expect. You feel a little surprised and a little disappointed, but you tell yourself that you are just tired that day and you push it aside. The second time, even before anything starts, a small question appears in your mind. What if it does not work again? By the third or fourth time, that small question is no longer small. It becomes a loud voice that keeps repeating, do not fail, do not fail, do not fail. And that is exactly when your body switches into survival mode. From a biological point of view, in order to have a good, firm erection, your body needs the parasympathetic nervous system to be in charge. That is the rest and digest state. When your heart beats more calmly, your blood vessels relax, and blood flows toward the parts of your body that create pleasure and relaxation. Anxiety, fear, and pressure activate the sympathetic nervous system, which is the fight or flight mode that your body uses when it faces danger. These two modes cannot dominate at the same time. When your brain keeps thinking, what if I fail again? Your body misreads the situation as a kind of threat. It starts sending more blood to your brain, your heart, and your big muscles so that you can fight or run, instead of sending blood to your penis. As a result, even though you want to be intimate, your body quietly shuts things down. The emotions that follow can be very harsh. You begin to avoid intimacy, using excuses like being tired, busy, or stressed, so that you do not have to face the risk of failing again. You start asking yourself whether you are still a real man. You worry that your wife or partner will misunderstand and think that you no longer desire them. Every night that you avoid closeness becomes another brick added to the wall that slowly grows between the two of you. The good news is that this spiral can be completely broken. The first step is not to search for a pill. The first step is to step back and look at your overall health. If you are still young or middle-aged and this problem has happened many times, you should have your heart, blood pressure, blood sugar, cholesterol, and hormones checked. The arteries that supply blood to the penis are very small, so sometimes erection problems are the earliest warning sign of issues with your blood vessels and your heart. If your test results show that your heart, hormones, and basic health markers are reasonably stable, there is a very strong chance that anxiety and overthinking are the main drivers. In that case, the most useful change is actually to lower the goal, not raise the pressure. Instead of going into an intimate moment with the mindset, "I must perform tonight and prove that I am still strong," you and your partner can agree that for the next few times you will focus only on hugging, kissing, touching, and being close, without making intercourse the target. When there is no finish line hanging over your head, your nervous system has a chance to return to a calmer state, and your body can respond more naturally and instinctively. For some patients, I also use a low dose of tadalafil as a temporary life jacket. This medicine does not create desire by itself. It helps the blood vessels in the penis relax more easily when there is stimulation. When you know that you have this extra layer of support, the fear of failure usually decreases, and your brain is less likely to slam the alarm button. At the same time, working with a therapist or a counselor who understands sexual health can help you untangle the false beliefs about what it means to be a real man. Understand the way your body works more clearly, and learn how to return to your physical sensations, your breathing, and the present moment instead of being pulled away by fear. Another reason many men quietly torture themselves is the habit of judging their own body by what they see in adult films. You may find yourself wondering, why does every man on screen look so long and so big? As if there is no limit, while I look nothing like that. You need to remember that adult films are not a truthful picture of human biology. They are an industry designed to overwhelm and impress. In real life, most men fall within a fairly narrow size range, and the large majority are close to the average. In adult films, you almost never see the average because from the very first casting step, producers select men who stand out in appearance, including in size. When the camera is placed at chosen angles, with careful lighting, editing, and objects arranged around the body for comparison, almost anything can be made to look bigger and longer. On top of that, many performers use vacuum pumps, stretching devices, temporary fillers, erection medications, and in a few special cases even penile implants. Every scene you watch is the end result of a long preparation process. It is nothing like the natural, spontaneous moments in the bedroom of a real couple. When you use those images as the measuring stick for your own body, the result is almost always the same. Your self-respect gets worn down. You constantly feel that you are not enough. You live with the fear that your partner will be disappointed if she ever sees the truth. The more you think that way, the harder it becomes to relax. And the easier it is to fall into the erection problems we discussed earlier. In reality, most women are not standing there judging every millimeter. They care far more about feeling connected, listened to, respected, and about how much you care about their pleasure and emotions. What truly shapes the experience for both of you is good blood circulation, reasonable stamina, rhythm, sensitivity in how you touch and respond, and emotional honesty, not a single number on a ruler. Comparing your size to adult film actors is like comparing your morning jog to an Olympic runner. It is not the same field, not the same goal, and not the same conditions. So instead of pouring all of your attention into size, try asking different questions. Is my heart and circulation healthy? Do I move my body enough to keep my blood vessels elastic and to nourish my body properly? What do I drink? What do I eat? How do I rest and sleep? Is my lifestyle helping blood flow to my pelvic area? or blocking it? When I am intimate, am I truly present in the moment? Or is my mind running away, worrying, comparing, and judging myself? Now, let us move to a topic that sounds small, but has a very real impact on your quality of life. This is split or weak urine flow and nighttime urination. Many men tell me that they have gotten used to walking into the bathroom, standing in front of the toilet, and suddenly seeing the stream split into two, spraying onto the wall and onto the floor. Some notice that the stream has become weaker over time, that they have to wait quite a while before the urine starts, that they still feel a heaviness or fullness after they finish, or that they have to wake up 2 or 3 times every night to urinate. They often say, "It must just be age. Everyone gets like this." Eventually, medicine looks at this story a little differently, and understanding the mechanism behind it helps you know what is normal and what deserves attention. Structurally, the urinary tract is very much like a tube. If there is a bit of mucus, dried semen, or sticky discharge right at the opening of the urethra, it can make the edges of the opening stick lightly together. When urine flows through, it can be redirected and create a double stream for the next 1 or 2 times you urinate after ejaculation. This situation is usually brief and not serious. However, if you notice that your urine stream is weak for a long time, that you need to strain, that the flow is interrupted, that you still feel discomfort or pressure in the lower abdomen after urinating, or that you need to go many times every night, then we begin to think about deeper causes. These include benign enlargement of the prostate, where the gland grows larger with age and squeezes the urethra, or a narrowing of the urethra due to scarring after infection, injury, or surgery. These conditions are not only inconvenient, they can affect your sleep, your blood pressure, your mood, and over the long term, if ignored for too long, they can place stress on the bladder and the kidneys. What you can do right away is to take a fresh look at how and when you drink water across the day. Try to drink steadily rather than all at once, and avoid drinking too much right before bedtime so that your bladder has time to empty before you sleep. When you urinate, give yourself time, do not rush. Do not try to urinate while checking your phone or doing something else. Let your body focus on emptying fully. Many men in Europe choose to urinate sitting down, especially in the morning, because that position allows the pelvic floor muscles to relax more, the stream is straighter, there is less splashing, and the overall feeling is more comfortable. If you have already tried adjusting these simple habits and the symptoms still persist or become more obvious, that is the moment to see a urologist. Today, there are many options, from lifestyle changes and medications to simple office procedures that can clearly improve your urine flow and your sleep, so that you do not have to quietly endure the problem. At this point, we have talked quite a bit about mechanisms and causes. Knowledge only becomes truly valuable when it is turned into specific actions in your daily life. If you suspect that your erection problems are driven by anxiety, do not rush to treat it as a life sentence. Start with a general checkup. Have your heart, blood pressure, cholesterol, blood sugar, and hormones evaluated. If these foundations are stable and your doctor does not find any dangerous disease, then allow yourself to reduce the pressure in the bedroom. Talk with your partner so that both of you understand that this is not rejection, but a period of retraining the way your body and mind work together. If needed, you can ask your doctor about using a low-dose erection support medication for a short time as a safety net, while you also seek help from a therapist to untie the knots in your thinking. If size is the thing that troubles you most, train a new reflex. Every time you watch adult films and feel the urge to compare, remind yourself that you are watching a stage performance, a product of selection, technique, and artificial aids, not a snapshot of ordinary life. Then, shift your attention to what you can actually improve. You can build a stronger cardiovascular system through regular movement. You can keep your blood vessels cleaner by limiting tobacco and alcohol. You can protect deeper, more restorative sleep and lower your stress level. All of these factors support healthy erections, but they also support your overall life. Even more important, Learn to communicate honestly with your partner about what both of you enjoy and what makes both of you feel comfortable, instead of suffering in silence and letting film images define your worth. If you are dealing with urinary problems, set aside 1 or 2 weeks to quietly observe yourself. How many times a day do you urinate? How many times do you wake up at night? Has your stream become weaker over time? Do you ever need to strain, or feel that you did not empty completely? These are not useless notes. They are extremely valuable information when you visit a urologist. They help us tell the difference between normal age-related change and signs of prostate enlargement or urethral narrowing. Along with seeing a doctor, some men are advised to use prostate support products that contain ingredients like saw palmetto, green tea extract, or nettle to reduce inflammation and support urine flow. However, these products should always be used under medical guidance, not as an excuse to avoid proper testing. Before we finish, I want to say this to you, not only as a doctor, but as someone who has listened to thousands of similar stories. If you have gone soft in the middle of intimacy and replayed that night in your mind over and over, if you have stood in front of the mirror or watched yourself against adult film images and felt disappointed, if you have been embarrassed by urine spraying everywhere and pretended to laugh it off, none of that makes you less of a man than anyone else. What you are going through is not a verdict on your manhood. It is a set of signals, sometimes very clear signals, that your body needs real attention from you. It needs to be checked. It needs to be cared for. It deserves to be treated kindly, not ignored and blamed. The strength of a man does not lie in never having a problem. It lies in how he chooses to face those problems. When you choose to have an examination instead of waiting until it is too late, when you choose to talk with your partner instead of hiding in silence, when you stop comparing yourself to unreal images and start rebuilding habits that support your heart, your prostate, and your nervous system, that is when you are rebuilding the foundation for long-term performance, not just patching a leak for the moment. If what I have shared speaks directly to your worries, do not let it end here. You can support open and science-based conversations about men's health by interacting with this video and subscribing to the channel, so you do not miss other important topics about erections, the prostate, the heart, hormones, and quality of life after 40, 50, and 60. And if you are willing, ask yourself one very simple question. What is the smallest change I am ready to start this week to take better care of my own body? From very small steps, your body can change, your health can improve, and your confidence can absolutely return, as long as you decide that today is the day you will stop running away. I am Dr. Laura Bennett. Thank you for staying with me until the end. I truly believe that if you are brave enough to begin, the rest of the journey will not only be about fear, but about control, growth, and freedom.